Thanks. I'll be very brief because I know Senator Menendez has a lot to do, but I wanted to flag, it's not exactly the topic of this hearing, but it's been extremely important in Rhode Island to have had mental health access through COVID through telehealth. It's been extremely important with people who are in recovery to be able to talk to their peer recovery coaches and to the people who are providing them treatment. And I just wanted to take a moment. I'm seeing a lot of heads nodding that this is a good thing, that we need to extend those telehealth protections and waivers, because the information that I have is not only did compliance, attendance improve compared to having to come into the office, but I know this is anecdotal and there's no way to put a scientific proof behind it, but over and over again, I've heard from the professionals in the community that the quality of the engagement increased with telehealth. And I suspect that's just the human aspect of not having to drive someplace, not having to wait in a waiting room, not having to fill out a clipboard, not having to be in unfamiliar territory. Instead, you just go to your quiet place in your own residence, you click on, and there you are. So I wanted to make that pitch. I also wanted to try to make the point that this problem of required networks and fake networks, in essence, is part of a suite of payment and cost-saving strategies that have developed in our current healthcare system. They include just plain payment denial and delay. We have an enormous armada of insurance effort to slow or deny payment to providers, obliging providers to then stand up a whole countermeasures apparatus. I remember years ago going to the Cranston Community Health Center and finding out that they actually had more personnel on staff who were devoted to trying to get paid than they had devoted to providing the health care that the Cranston Community Health Center provided. So there's an enormous burden of unnecessary administrative cost from that. There's an enormous burden of administrative cost and pain from these fake networks. And I think that prior authorizations are another vehicle frequently used by the insurance industry to evade and avoid payment for services that are pretty clearly required. And what I would really like to have anyone who's interested do, and you can do this as a response in writing, consider this a question for the record. I think the way out of most of those problems is comprehensive payment reform. The more we get away from fee-for-service, the less ability there is to deny and delay the payments for those services, to shrink networks, and to impose prior authorization restrictions that foul up treatment. So we're continuing to work to get that done here. I think the ACOs, the Accountable Care Organizations, provided a good lead that have provided, particularly in Rhode Island through Coastal Medical and Integra, some really good results showing what's possible. But I'd love to have your careful thoughts on that. And is this area of reducing the deadweight cost burden of the administrative warfare between insurers and providers likely to be alleviated by payment reform? And if so, what payment reforms are likely to alleviate it most? And with that, I'll yield back to Senator Menendez, I guess. I'm not sure who's next. Senator Cardin.
We're going right up the line here. So.